This podcast contains our own personal views not associated with any organisation. Coronial contains descriptions of death inquests that may be graphic and disturbing to some listeners. Discretion is advised.
Welcome back to Coronial, everyone. I'm Georgie.
I'm Emma.
And I'm Alice.
And this week I'm going to be discussing with you the death of Shane Tuck, who died at the age of 38. This episode does need to come with another mental health warning, as it discusses an individual with significant mental health issues and suicide. So if this is not an episode for you, happy for you to skip on through. So, as I mentioned, I'm going to be discussing the death of Shane Tuck. Prior to his death, Shane had competed professionally in both Australian rules football, AFL, from 2004 to 2013, as well as professional boxing from 2015 to 2017.
What AFL club did he play for, do you know?
That is a good question.
Just out of interest, because that's a pretty long career.
It did mention it, and then I completely
You're
ignored
not
it.
an AFL person.
Well, I support it more than I do...
NRL.
Yeah, NRL, but
Yeah.
Richmond Football Club, so out of Melbourne.
Yep.
He had a pretty significant AFL career. People who know about AFL will probably know who Shane Tuck is. Clearly, we do not. You will when I start talking about this, but we've definitely had a conversation about this.
Oh, okay, fair. Not from my sporting knowledge.
No. From the coronial inquest perspective. Yes. So the events of Shane's death are clear and entirely uncontested. So this is going to be a slightly different episode because we're not really going to talk through the events of his death. We're going to talk through a whole bunch of other stuff. Following a number of years of difficulty with cognitive and episodic memory impairment and mental health issues, including depression, auditory hallucinations, and obsessive intrusive thoughts, Shane took his own life. Over the years prior to his death, Shane had contact with a number of mental health services, including being prescribed a number of medications to manage his symptoms and inpatient admissions for his symptoms. In the weeks leading up to his death, he was in touch with a local mental health service, as well as they were in touch with his family with his permission and part of his care. The coroner found that this care was reasonable and appropriate in all circumstances, and no opportunities for additional care were identified.
Right.
So why is this a coronial inquest? And this is the bit that interested me that I wanted to talk about, because this is a case where the coroner used their right to comment on any matter connected with the death, including matters related to public health and safety or the administration of justice, to expand the scope of the coronial inquest. And I don't know how much we've actually aired it within the podcast, but I know we've had a lot of conversations around sometimes like, why is the coroner so strict about the recommendations? And the one I always come back to is the bodybuilding episode where it's like Anytime Fitness. All of the inquest findings and recommendations were specific to Anytime Fitness. And I was like, why are we not increasing this to any 24-hour gym or any gym?
Any facility.
Yeah. And I was like, because I would assume that Anytime Fitness is equally as likely to have that happen as any of the other major brands.
Yeah.
So why did the coroner expand this? Essentially, the coroner aimed to consider whether there is scope for improvement in player safety for professional Australian rules footballers and boxers, specifically in relation to head injuries. And so this consideration was specifically related to the fact that during a specialised autopsy, Shane was found to have changes in his brain tissue, which were consistent with severe chronic traumatic encephalopathy, or something known as CTE.
I've definitely heard of that, like on the news and stuff.
Yeah, it's very well acknowledged now that there is potentially an association between the number of times you are hit in the head, more commonly linked with sporting activities, because that's where you're more likely to receive trauma to the head.
Yeah, especially contact sports.
Yeah, but you know, it being not necessarily so major that you end up with an acute traumatic brain injury that damages you permanently then, but rather that constant repeated knocks that end up giving you long-term delayed neurological consequences.
And I might be completely incorrect here, but obviously there's been a lot more player focus in different sports around the concussion rule, and they're very strict on it now. They have the concussion testing to even the slightest knock of the head. And if a player has any sign of concussion, they're sent off. But I'm not sure whether there's like a certain rule of you're only allowed to accumulate like a certain number of concussions in a season, or
not that this inquest talks about, but it certainly is. We're going to go through the recommendations very much a priority the coroner wants to see happen, that there is real emphasis on reducing that.
Yeah.
Not so strict as to like, you have to stop playing as of, you know, X number of head knocks. Because again, if you have 10 small head knocks, is that equivalent to one severe? Hard to tell. And, you know, what qualifies as the count towards that and all that kind of stuff.
And it also is, again, that sort of bodily autonomy that I know we've spoken about before of like, some people might say, I meet the threshold of 10 head knocks, but
I have the right to keep going.
Exactly. Yeah. I still want to play. Like, I understand the risks and I still want to continue to play the sport. Like, it's really...
But if you're getting cognitive impairment from your head knocks, like, do you still understand the risks? Like, are you still able to...
do you still have capacity
to do that? And it becomes really challenging there. But we're already having this discussion, technically entirely unrelated to his death. Like, the coroner, I just feel like, went so far outside with all of these recommendations. And that's the bit that
scope was broad.
So broad. Because even now it's not necessarily proven that this comes from that.
But there's a significant causal link, right? Like,
well, but are
still
you
an association, and it's still not. And there's some people think yes, some people think no. I'll come to some statements that the AFL and the AFL Players Association released. I'll go through a bit more about CTE first, and then I'll tell you about the specific wording that they have around what they think are the risks. But also, I don't even know why he got the specialised autopsy and whether that was as part of the coronial inquest or if that was like personally...
Maybe the family requested it.
And personal funding, so family funding, or whether that was an AFL thing, or like there was kind of no, how did this get to here? And then also I'm like, does this coroner have a real bugbear with sports? But then I kind of did some looking into like the coroner, has he done a lot on sports or published anything else? And I couldn't find anything. I was just like, is there a really heavy bias here? Has he got like a family member that's died from a head injury or something? But I couldn't find any really heavy bias. So I assume it is just, you know what, I'm a coroner and I think that this is something that needs to happen for public safety.
Yep. I'm going to be the one to do it.
Yeah. And your point on an autopsy is quite interesting because obviously, as you're saying, it wasn't a death that was, as far as we know, directly caused by this issue. It was a suicide.
Yes.
And so, like, they knew what the cause of death and the manner of death was.
And so, I was like, how did he end up with, I would assume for his manner of death, that he would have needed an external evaluation only. So the fact that he even had an internal autopsy that required, that ended up having the brain changes, someone had to have pushed for that. There's no way that would have been standard.
And I would think it'd probably be the family because I don't know what, like, presumably the length of time before, like, a coroner is notified. I know for this case, he was the one who sort of interjected and wanted to do a coronial inquest into this, but, like, what that time period would be after the death to when that was actually requested. And I also don't know, like, how long a body is preserved before an autopsy is no longer valuable.
Coroner is notified of any death at the time of the death. But in terms of the autopsy and all that kind of stuff, I guess when you refrigerate, preservation is not terrible.
But and what time frame, especially for the specialised brain
changes. But I think it's looking at protein within the brain. So I assume that's fairly stable. But I have no idea. And I don't know the time frames, don't know the availability. Don't know if that's a routine thing to happen for ex-AFL players nowadays, that kind of thing.
It could potentially be, like, especially ex-sporting players who have a history of concussions, who have a history of mental illness post-career. It might be. I don't know.
Or he might have voluntarily consented to that post-mortem.
Yep. That's true.
But it was never mentioned.
When was this report issued?
Last year. Sorry, by last year I mean 2023. It's pretty recent. And he died in 2020. Sorry, I didn't actually mention that July 2020 was when he passed. So chronic traumatic encephalopathy, let me just give you a brief overview. Medical literature has reported that there is an association between repetitive head injuries and brain changes that cause delayed onset of cognitive deficits, including impairment in executive functioning and memory. So his partner, mother of his children, had reported things like he would often forget his keys to the house when he went out. That was unusual for him pre-football or football era and all that kind of stuff. And he just wasn't functioning like the average 38-year-old.
Yeah, right.
From a functioning and memory perspective. And there's concerned that it's the number of head injuries rather than, say, the number of concussions or the severity of those, although there is some emerging evidence that it also may be severity as well as number.
Which wouldn't make sense.
Yeah.
If it's severity and number.
Presumably, but I guess if it's really severe, then you can go on to just like an acute head injury that causes
Yeah. In the moment issues rather than delayed.
issues. So I don't know how that affects things.
And do you know, if they'd ruled out early onset dementia for him?
There is no other information about other potential contributors.
Yep.
But he had brain changes consistent with those that are seen in chronic traumatic encephalopathy, which are very similar to what is seen in dementia, but I don't know that they are exactly the same.
Yeah, okay.
Oh, and sorry, by dementia, I mean specifically Alzheimer's dementia, because there's obviously different types as well. The only way to diagnose CTE is on specialised autopsy. It's not something that can be diagnosed prior to death, and it's not something that would be routinely picked up on autopsy. On autopsy, it's characterised by build-up of abnormal proteins in brain cells, especially near the blood vessels and in the deep parts of the brain folds. And as I said, they're similar to other protein clumps that are found in other neurodegenerative diseases such as Alzheimer's.
Gotcha.
Prior to death, though, there are some common clinical features that can be used to predict the likelihood of someone having CTE. That includes substantial exposure to repetitive head trauma, so such as through a career that involves contact during sport. Delayed onset of progressive cognitive impairment, delayed onset of symptoms, motor signs like Parkinson's, which is difficulty initiating muscle movement, essentially. Mm-hmm. Psychiatric features of depression, anxiety, apathy, or paranoia, along with neurobehavioral dysregulation. But those are all pretty broad in my mind. Yeah. So I think it's also like, as you said, what if it's a different diagnosis? Evidence has found that reducing the overall number of head hits a player receives during their sporting career may reduce the risk of developing CTE. So as we sort of talked about, the evidence supporting this diagnosis is new and it's been collected without extensive studies accounting for other possible factors, including things that are commonly seen in elite sporting populations of individuals such as potential for alcohol and drug abuse, or other things like genetic predisposition or psychiatric illnesses. And I think it's also not uncommon for elite athletes to have a period of depression following retirement and those kinds of things. I think that's
a big life change.
Yeah. I think that's not an unreasonable illness to go through after that.
Yep.
And so strategies to try to reduce the risk or even identify it are continually evolving. During the inquest, the coroner stated that they were satisfied after having considered expert witness evidence that CTE is associated with repetitive head trauma, including concussive and subconcussive hits. Whereas the AFL's 2023 position statement considers that extensive exposure to repetitive head impacts may potentially be associated with the development of CTE, and the AFL's Players Association position was that a clear link between sport-related concussion and CTE has not yet been established, but there may be a link. So this is going back to essentially saying that it's not definitively causal.
Yes.
At this point.
Because there haven't been enough studies, and me as someone who has had very few, if any, head knocks and concussions in my life.
Yeah.
Are they doing the specialized autopsies on quote unquote normal brains?
Yeah.
To see whether they also have an element of this?
So from my understanding, the way it was worded was that some have been done and that it's very unlikely to be seen in non-elite sport players.
Yep.
But what about those people that have played college football all their life and had a number of head hits? I don't know about that level of individual versus those who just haven't had any. Then again, my assumption would be none, and that they've done enough of that to say very distinctly different, but it's that middle ground that I struggle with.
How many and how bad do they need to be to actually cause it?
Yeah.
And is there even a number? Or is it dependent on the brain?
Yeah. And it seems to be very sport focused. And I couldn't think of many other occupational hazards that would lead to a number of head injuries, but surely there are.
I don't know, there'd be professions where you're more likely to injure yourself in general.
Yeah.
If you're a bricklayer or
and maybe,
a
I guess,
landscaper
in those
or something.
Industries, you're more likely to be wearing a helmet,
Yeah,
whereas it's
that's
harder
what
to
I'm
do with
thinking,
sport.
Construction, where there's potential falling of.
But again,
things.
repetitive on your head, probably
Yeah,
less so.
you're more
it's
likely
more
to
of a-
injure your limbs or
Or once you get hit on the head once, someone changes something so it doesn't happen
Yes.
again.
Yeah.
Yeah, it's not an industry where you are expected to hit someone else with your body.
Yeah. Fair.
No.
Fair. Often with your own head.
Yeah. Just go run into that guy's head with your own head.
Yeah. Sounds fun, right?
Or, punch that guy in the head while he's punching you in the head, in the case of boxing.
I was about to say, outside of boxing, that's assault.
Well, it's also like, I think in boxing it's a little less hit them in the head now, but we'll get to that.
Yeah.
In terms of Shane's background, he was reported to have sustained a number of head injuries at various times during his AFL career, but never so severe that he had a loss of consciousness. But it sounds like he had the average number you would have as an AFL player,
And
whatever that may be.
Because if you're at the elite level, you would have been playing since you were a child. And
Yeah.
I believe they have no contact rules for children up until a certain age.
I think
But
so. Yeah.
let's say he was a teenager when he started getting head knocks.
Yeah,
And
exactly.
then that continues.
Just because
for-
he only played professional AFL
Yeah.
for 20-something years. But it also doesn't talk about, once he'd retired, did he go play in a social club or
Yeah,
anything
possibly.
like that as well. So
Yep.
who knows? During his boxing career, he did sustain one significant head injury, which caused a loss of consciousness and resulted in a subdural hematoma, which in my previous boxing episode, we learnt about what they were.
Mm-hmm.
And so this was related to that boxing inquest. This was mentioned in that inquest, which led me to go down this rabbit hole.
Gotcha.
From as early as 2006, he was reported to have developed significant changes in his behaviour, including obsessive health and fitness regimes. But 2006 is only 2 years after he started in professional AFL. So
Yeah.
that to me
Yeah,
raises
that's
some
not
questions.
necessarily
Yeah.
a brain change. That's I'm now at a professional level of sport.
Yeah.
I need to be fit.
Yeah. It was described as a bit more than you would expect of a standard, professional athlete. But again,
Gotcha.
what's standard?
Yeah.
He began receiving treatment for depression and anxiety by 2010. And then after retiring from the AFL, his symptoms worsened. That, again, didn't surprise me.
Yep.
And around 2018, he started experiencing psychotic symptoms, including auditory hallucinations, but never received a diagnosis of psychosis specifically.
Right.
He was also reported to have had cognitive and episodic memory impairment, such as I mentioned before, forgetting the keys and things like that. Additionally, it was reported that at least during mid-2018, Shane was consuming heavy amounts of alcohol, but it didn't talk about pre that or post that. So we just have one point that he was consuming heavy amounts of alcohol, but I don't know if that was a long-term ongoing
Yeah, was
issue.
that almost like his normal, or was that a significant change in behaviour?
Yeah.
Did he not drink at all and then he went to heavy drinking?
Yeah.
Or,
Yeah, so hard to tell. And so getting back to that, how much of this could be contributed by other factors.
yeah.
But the coroner did find that features shown by Shane prior to his death were likely predictive of the presence of CTE. So in total, there were 21 recommendations that the coroner made as a result of Shane's death,
Wow.
none of which related to suicide or to the specific circumstances of his death.
Yeah.
So I'm just going to literally run through them along with what is already being done by AFL and boxing leagues. And then I'll chat where I think things are just a little bit over the top and
Yeah,
a bit
fair.
more controversial.
Yeah.
Because there's no real in-depth process of what actually happened related to the acute circumstances of his death.
Yeah.
And so these recommendations kind of grouped into risk mitigation for the AFL, participant education and safety, as well as research in both the sports related to head injuries. And then all of these strategies that were discussed that are currently in place, none of which were in place when Shane was playing anyway.
Yeah.
And so it's also none of that was in place while he was playing. So yeah, sure, he was probably at higher risk anyway. But the coroner had strong recommendations to make it better still. You'll find a theme. So risk mitigation strategies applied by the AFL. They currently have a number relating to management of head injuries and concussions sustained during training or gameplay. And these were developed in collaboration with the AFL Doctors Association and the AFL Concussion Scientific Committee.
Wow.
I mean, it makes sense considering how much attention this has gotten over the last few years. But
Yeah, and I guess it's probably one of the higher risk concerns and or consequences.
yes, yeah.
It's a high risk sport and it's also a very popular sport. So it's got
True.
a lot of money backing it. as
But
well.
also they probably then need to be seen to be doing all of the right
Correct.
things because it's got a lot of public trust in terms of keeping everyone safe.
And it's not good when a player ruptures their ACL But
No.
they can have surgery and continue their life after
Yeah.
that, whereas this is
Higher
seemingly a
consequence.
life-limiting condition.
Yeah. So assessing for head injuries, yeah, you were right before, Emma. The AFL does monitor for concussions and then remove them from the field if there is concerns about head injuries. So much so that they have concussion spotters that sit on the sides of games in a box somewhere, I assume, but they're literally watching from a media center, and so they can watch the game and they're looking outside of where the game is being played. Like they're watching for the stuff that might get missed, where two people happen to collide nowhere near
They're
the
just
ball.
running around and they hit into each other. Yeah.
And it sounds like they're not only able to see the gameplay, but then they've also got monitors with them as well. So again, they can zoom and watch and replay. And then if they go, nah, that even on replay looked questionable, we're going to call them off.
Yeah.
But what they do actually instead is notify the team doctors if anything's been missed. And there is a mandatory review of game footage when a concussion assessment happens to have a look at how hard the hit might have been. There's also a mandatory head injury assessment tool that is required to be completed, as well as another one called a sport concussion assessment tool. And this is done by the team doctors while they're reviewing the player, which has to happen over a minimum of 15 minutes. So they get a minimum of 15 minutes off of the field as well. And then all coaches are also required to have compulsory head injury training, along with, obviously having a team doctor.
Interesting. On the coaches, because what are they? Is it just like to look out for the signs of?
Yeah, they're the ones interacting with the players more often. Like the
Yeah.
team doctor would only get called on if there's an incident.
Yeah, but I guess the coach would
coach is
be
there all the
looking out, being
time.
like, okay, this person is acting abnormal, and they did have a head knock.
Yeah.
Are they having like
potentially.
delayed
Potentially.
symptoms or something?
Also, in terms of not putting pressure on that player to, say, return to sport too soon and all that kind of stuff, I think it's not unreasonable for them to have the knowledge to then understand, like, the decisions the doctors might be making as well.
Yeah, that makes sense.
If a player is diagnosed with a concussion, then they're removed from the game. If they're suspected of having a concussion, as I said, that assessment happens over 15 minutes. And then, ultimately, if they have a concussion, recovery protocols are recommended. For professional AFL, this mandates a minimum period of 12 days post-concussion for recovery, whereas in the community, so lower levels of play that are not in this elite professional area, it's advised by whatever treating professional that they seek medical advice from. And they are recommended to go seek medical advice.
Of course.
I also forgot to mention that all of this applies to both AFL, we know as the standard that existed as we were growing up, men's, but also the women's.
Yeah.
Oh, yeah.
Because that exists now and all of it is encompassed in one now.
Wasn't there recently, or semi-recently, a woman who something similar happened to who was playing for the AFLW, where she also took her own life, and they think it was because of
CTE. There
Yes.
is someone, there was an AFL player actually.
an
now that you say.
AFLW player. Yeah, I forget her name, but it happened fairly recently.
Heather Anderson?
It rings a bell.
Yeah. Heather Anderson. She was an AFLW star and a Defence Force medic.
Oh, wow.
It was a shoulder dislocation that prevented her from going back. But she looked like she wore headgear.
Potentially because
So
she had
So many head knocks. Yeah.
head knocks.
But I don't know whether she's had a autopsy of her brain.
Yeah, late Australian footballer Heather Anderson, first diagnosed case of CTE brain
she
trauma
was.
in a female
Yeah,
athlete.
okay.
Yeah.
Yeah, wow. Other strategies that have also been implemented to reduce the risk of sustaining a head injury include, but are not limited to, they've banned boxing as a training method for AFL fitness. So within clubs, they can't be sparring or boxing to keep up their fitness.
I assume they can do like the boxing where you're not hitting someone in the head.
Like bag boxing. Well, it says
Or maybe it's just not
banning
at all.
boxing training within the clubs. So
They just don't want to promote it at all.
yeah, potentially. I also don't understand why you would be sparring with each other. Why would you be hitting each other?
Yeah,
That
'cause,
just
like,
seems like unsafe from an
boxing
injury
for
perspective.
Fitness makes sense, but yeah, you wouldn't think you would be sparring with
yeah.
another person.
But anyway, it's been banned. Rule changes related to tackling and protecting the head, although from reading this inquest doesn't sound like they were being implemented particularly well.
Guess because that's very reactive, isn't it? They're sort of banning it in a game, but it's like it's only after it's happened that they're like, you shouldn't be doing that.
Yeah.
You know what
yeah.
I mean? You're not actually stopping anyone from doing that.
Yeah.
You're just punishing them if they do.
Yeah, so the next step is upgrading impact categorizations based on the potential to cause serious injury and higher sanctions when prohibited contact between players involves head contact. So yeah, it's a reactive way of doing it.
Yeah.
And it sounded like shortly after this inquest started, or, you know, the AFL fed back that, yeah, we've changed rules. They then gave a really weak sanction to someone who intentionally head knocked someone. And so the coroner's like, you said you were doing stuff, but in practice, are you?
Yeah, fair.
It's difficult as well with AFL because obviously there is the intentional stuff that happens. And I know obviously AFL, it is a contact sport, but only contact below below the shoulders and above the knees.
Yeah.
Yep.
Is the area that's allowed. And then obviously anywhere outside of that isn't allowed. But the problem that you see with a lot of head injuries in the AFL is accidental, and there'll be head clashes. So people are watching the ball and they're not paying attention to what's happening around them, and there'll be two people who are doing the same thing and they're obviously aiming for the same spot. They just hit heads.
Sometimes there's also players that do something wrong, and it's not because they want a head clash, but it's their inappropriate activity that then accidentally leads to a head injury as well.
That does happen, so but I think like the more common thing is the former is an accidental, and it's like, how do you go about preventing that?
Absolutely.
Obviously, the intentional stuff, giving higher sanctions makes sense, and absolutely supportive of that, but it's difficult. I just don't think it can be sort of proactively prevented in a sport, and I think people play the sport knowing there's an inherent risk.
So is there other things you can do to mitigate, such as helmets?
Wearing headgear.
Yeah.
And it's interesting because you look at a lot of other sports that are similar contact as AFL, and they require a lot more gear. Like, I think American football, rugby probably should have helmets too, to be honest.
I think some rugby players wear the padded ones.
But that's more so for,
and even some
strumming.
NRL players, I think, wear those as well.
But there is some discussion about how protective, like even that small adjustment could be protective.
Yeah. It's not going to make it worse, that's for sure.
You say that, but the question is, if you put on a helmet, does that make you less conscious of getting a head injury because you think you're safer?
Yep.
And so that could be actually a negative downside. And so the AFL is still conducting research around that because they're worried the introduction of them could actually make people play less conscious of the risk of head injury.
But I think people are pretty unconscious of the risk of head injuries as it is, or they play that way at least. They're conscious of it, but they play. And it's always a big thing that they talk about in like commentary and stuff. They're like, oh, that player is just so brave.
Yeah.
Their eyes are on the ball. They have no regard for their own safety. They're just like dogged at the ball. And it's like praised.
Yeah.
Yep.
So maybe there needs to be a turn of like, no, you do need to actually protect your head.
But also maybe we don't need to run into each other for entertainment.
I don't think that's
I don't think that's
the whole root of sport, essentially, of like why do we
if we're gonna have this argument, can you have it when we get to the boxing?
Yes, fair.
Yeah,
because if we're gonna get rid of a sport, boxing
it should be the one where you're actually meant to punch each other in the head.
Yeah.
Whereas I think you'll find that AFL generates way too much money for it ever to be.
So talking of the US, the main expert witness that existed for this coronial inquest was a international expert witness who specifically focused on concussion management in the US's National Football League, the NFL.
Yeah.
And commended the AFL for their consensus guidelines for the management of sport-related concussions and the changes that they have made that have improved the risks, but did have a few extra suggestions, which then the coroner was like, I will make these formal recommendations.
You're the expert, I'm going to listen to you.
But also, it's a different game.
Yeah.
That's regulated very differently and played very differently. And so, like, they are running at each other, but they have full gear on, and it's very short stints. I don't know if you guys know many of the rules, but essentially
not really.
Each team actually has two teams, and so it's only like one of those, and then like the whole team is off.
Oh, yeah, you've got offense and defense, but only one of them is on the field at the same time.
Essentially, is my understanding. I have very little understanding. Let's remember this.
That's more than I knew.
But I also, so like the game time, I think, is horrendously different, but also the force of collision is also very different. You said, mostly in AFL it's accidental. In NFL, it is intentional running at each other at high speed, and hence they are required to wear a helmet. And so I also think that that is going to be slightly different, and that those risks are going to be slightly different. And so I don't think that they're 100%
Yeah, and I also think the fact that in America you wear so much gear, it changes the way that you tackle someone. Whereas if you're not wearing any at all, you've got more maneuverability, you can...
Yeah, true.
Yeah,
I just think that
yeah.
having all of that, like the big shoulder pads and
it's
all
not
that
conducive to AFL, and I even think
it's just going to change the way that your body interacts with someone else's body.
Yeah.
And like obviously in the US league, they wear those big helmets, like the proper full face, the hard helmets, whereas we're talking about the soft helmets here because I don't think you couldn't wear those hard helmets.
No, because
in
you could
AFL.
give someone else a head injury.
Exactly.
Like, you either all need to wear them or none of you wear them.
Yeah,
and
no, it's
also
not
it'll
possible.
just impact the way the game is played
Yes,
because
absolutely.
you have to be very
Visibility.
aerodynamic in
Yeah.
AFL and be able to jump like
And,
on
like,
people's shoulders and stuff.
Weave and dodge and...
if you've got a heavy head because you've got this big thing on, you're not going to be able to
can't
do
jump.
that. Exactly.
Absolutely. So yeah, and look, the recommendations weren't related to training gear anyway,
Yeah.
so it's okay. This expert witness's recommendation said limit the number of contact training sessions that the AFL players have across the year. So when you're training, have a lot more non-contact time.
Oh, yeah.
Again, has pros and cons though, because again,
Yeah.
if you're not training for the contacts, does that also limit the amount of knowledge you have to prevent serious injury?
Yeah, or even just do it better.
Yeah.
And that makes me think that a lot of these concussions occur out of gameplay.
And it's unclear. They didn't talk about any kind of statistics of
Yeah,
how many
true.
happened, but they did say if you get a head knock at a training session, it's like, cool, go away now. Versus like there's a lot more pressure to come back on when you receive the head knock
Yeah.
in a
Yes.
professional game.
Yeah.
And so I think that's also the big issue is the people playing even after they've got a concussion. It's probably rarer now, but surely you and I saw games growing up where it's you're so brave, you come back on and it's like...
Yeah. And they're like half staggering.
Yeah. Like, not entirely sure where they are.
Yeah.
I watched a hockey game where a chick got a hockey ball to the head and then came back on like 20 minutes later and kept playing with an ice pack bandaged to her head. And I was like, you have to have the worst concussion right now. There is no chance that you are not moderately injured. Why are you still playing?
they don't wear helmets in hockey.
And hockey balls are dense rocks.
Yes, and
They
they are
are-
hit at very high speeds.
Yeah.
Well,
yeah,
in
it was
fields,
yeah.
in field hockey, they don't
Yeah.
wear helmets. They wear helmets in the other forms of
Oh, yeah,
Oh, yeah,
sorry.
ice
You know a lot of ice
hockey.
hockey. Anyway, other recommendations were to continue to provide education materials to the players, along with community players, along with club doctors, coaches, trainers, basically everybody that has anything to do with football. Make sure that they're aware that head injuries are bad for them.
Yep.
Specifically related to repetitive injuries and long-term related
Yeah,
issues.
I feel like everyone knows that a head injury
It's not ideal.
by itself is not a good thing. But yeah, it's the...
Yeah, really like harp on that
long-term-
there is long-term consequences of it.
It's so tricky though, because obviously everyone who plays this professionally are young. And it's with everything, right? Like, you know that drinking excess amounts of alcohol is bad for you, but you still do it anyway when you're young. Like, it's,
Yeah.
it's
Yeah,
like
yeah.
harping on about future consequences
hard, yes.
sometimes doesn't ring true to people.
Yeah, absolutely.
Absolutely. How many times do I turn around and be like, that's future me's problem?
Yes.
Yeah.
Every day.
That is something I will deal with in the future.
Yeah.
And yeah, I agree with you on that one, that it's hard to...
Yeah, and
It's
especially
really-
if you're at the elite level, you're making good money.
And
Yeah.
You know
And
that
it's-
it's not going to last very long.
And there's a high
because-
amount of pressure to perform well, or
Yes.
you're going to lose your spot in the team.
Yeah.
Yeah, and your very large salary.
Yes, and then your
Exactly.
livelihood is gone because you spent your entire life working to this point and you have no other skills.
And then finally, that the AFL implement a rule which allows the concussion spotters to mandate a player is removed from the field for medical assessment. So as I said, they just call the coach and then tell the coach that they saw it. The expert witness is like, no, they should have the right to remove the player. The coach just can't then sit there and be like, nah, they'll be right.
Yeah. Especially if the coach is obviously focusing on the game where the ball is. They're not looking necessarily, haven't seen necessarily the head knock that the spotter has seen.
Yeah, the spotter obviously can describe it to them and then the coach can watch it back and should.
Yeah,
But also
true.
there's the concern about the independence of the coach versus like what's his
agenda?
there might be some bias.
Yeah.
So then the next recommendation that I'm going to talk about, this one's slightly more controversial, is that they employ an independent medical practitioner to attend all elite AFL games to assist club doctors in the assessment of a player for suspected or actual head injury. So basically the coroner's like, they're too biased. The club doctor is going to be looking out for the club, not for the player, and therefore is going to be more likely to let them off
things
lightly.
slide.
That's a bit
No,
judgmental.
I
isn't
get it. It's their employer.
Well, I know, but like
there is a conflict. There's technically a conflict.
There is a conflict of interest, but they're also a medical professional,
Exactly.
so they
Yeah,
should
true.
be
exactly
bound by the
Yes.
higher
They should
regulation
be.
there that they
Yes.
should be making the decision for the player, not.
But the medical practitioners board is not paying their salary.
Yeah, that's the thing, because they're getting paid by the club, but
Correct.
their duty of care is owed to the person.
Yep.
Correct.
Yeah, it's
Yep.
hard.
So there is a conflict. So I do understand that.
Yeah.
Not
I mean,
on-
not that I agree that
That's
I would
happening
it
necessarily.
was happening, but I do understand the
So-
recommendation.
The next kicker is that the coroner also recommended that if that independent medical practitioner is employed, they recommend giving the independent medical practitioner the ultimate power should a disagreement occur between them and the club doctor. So it was also like, if they come along and they
They're
assess
coming
the
in
player.
and they're coming in
Yeah.
above you, basically.
Yeah, and I was like, no club doctor is going to want
Ooh.
that. But also it makes the club doctor a little bit redundant.
Yeah,
but also
absolutely.
it's only specific to head injuries. So I was like, why? What incentive does the AFL have to bring in another independent person just for head injuries?
Especially the cost that would bring
Exactly.
as well.
I don't think cost is an issue though.
Yeah,
no,
I-
but still, like if it's coming out of is it coming out of the clubs?
I would say it's the overall AFL budget, right?
it'd be the overall AFL because it's an independent person. So you can't come out of any club because they
Yeah.
need to be independent.
And it would be one person per game, right?
Yeah.
So it wouldn't be like one person per team.
Yeah.
Mm.
When providing this recommendation, the coroner went on to state, I do not consider this initiative to be overly burdensome on the AFL, as the experience provided is that the AFL already has an established network of experienced expert clinicians that work in the management of sport-related concussion. So basically, the coroner was just like, you know enough people that you would be able to get someone at every game.
But if you
Oh,
know
they would.
enough people, aren't they then also biased?
Probably.
Like
Yeah.
ideally, that independent person has no affiliation with the AFL
Oh, in
at
whatsoever.
all, ever
But
in the
it's-
past.
I think it's just more it's that perceived conflict versus the
Yeah.
actual conflict, right?
Yeah.
Like
But even so, again, just like an extra person just for the head injuries. If you're going to do that, take that to every injury that they get. Because same thing, if they tear their
Yeah.
ACL, I can't imagine it's great to continue to run on it.
No.
But the club doctor might say, you'll be right, let's have some pain relief and off you go.
Yep.
yeah. It's an interesting one, and I think even between us we've got different opinions.
Yeah.
So-
So then the coroner went on to recommend to the Royal Australian College of General Practitioners, which
Who
again,
have
I've
no affiliation with
AFL in any way
sporting at
whatsoever.
all. Yep.
The expansion of the college's education programs for the short and long-term effects of repetitive head trauma associated with contact sports and the risks of developing serious brain injury for those that are training to be general practitioners, but also those who are general practitioners to upskill their knowledge.
So that sounds relevant in terms of casual sport, social sport,
Community AFL,
Like-
maybe?
teenagers who are playing it,
Yeah.
but not at the elite level.
Yeah, and so every doctor that was mentioned in this, and then I did some quick Googles about other team doctors, every AFL team doctor I could find was not a general practitioner.
No, you
they were a
wouldn't be.
sports. They were a
Sports,
sports
yeah.
physician.
Yes.
Sorry, sport and exercise physician. Why did you
not
not make
relevant.
this to the sports and exercise
Yeah,
physician
that
college
makes
then?
sense to me.
They exist. What? So I was like, you didn't even.
Didn't do his research.
Yeah. I was
He
like,
or her coroner.
so, and maybe it was because it's meant to be directed at the community, and for community players, so that lots of GPs, when they see the
That's
kids that have
true.
been playing AFL, are treating them appropriately for that long term consequence. But I don't know, it's confusing of like,
Yeah.
who are you directing this
That just
to?
sounds very
You just seem like
random.
you're throwing way too much out there. So that was the first few recommendations. Sorry. We got a few more to go. Education. AFL provides lots of education for both their players, their teams, but also for the community. As we've discussed, it's huge in Australia. If you want to play AFL, you will learn about things playing it. Heaps of materials. At the time of the inquest, the AFL had a education material that focused on concussions but didn't specifically highlight the risks of repetitive injuries, nor do those education materials reach prospective players such as those commencing Auskick, the introductory league for Australian rules football. Now, I haven't looked up Auskick in terms of if there is an age limit, but
I think there is.
I feel like telling a 5-year-old
Yeah,
about the
too
long-term
young.
consequences
No.
of a head injury
No.
isn't really going to get very far anyway. So really, you just need to educate the parents.
Yeah,
But
and also
whatever.
like I feel like parents of kids that are that age, they're very aware of the fact that their child could get injured. and it could
Hopefully.
be bad.
Like,
Like,
also
I
shouldn't
just-
be contact at that point anyway,
Yeah,
either as
exactly.
well. So anyway, make sure that the children who don't understand what a concussion is know not to get one. They also said that the education material about repetitive head traumas should be done so expeditiously and include material with accessible language through a variety of platforms, and there should be means to reach out to different community groups such as urban versus rural, and whether they need to be different for those populations of people, and that there should be also extra targeted information at points of transition where there's a heightened risk of head injury. So that one I can get on board with, where you go from non-contact to contact.
Yeah.
Seems like the most obvious place that you would want to make sure that there is a heightened amount of education at that point.
Yes.
Or potentially that transition from community to,
Semi-elite, pre-professional.
slightly more than school to professional
Yeah.
to proper elite. Yeah. But either way, all of that seemed like a lot of recommendations. It was just like, cool. Just do everything all at once.
Immediately.
For everyone in an accessible manner for literally the world's population.
Yep.
Sorry, I'm getting a bit cynical, but I was just like, wow. There was a lot of need to do this action quickly. And look, this was released in December 2023, and I'm not convinced that anything has actually been enacted yet. As in, none of this can just happen.
Yeah, no, there's a lot of work that needs to go into that.
Yeah. And then for the elite players, the coroner recommended that the Players Association assist with further education and training for players on concussion. And
That
the
makes
risk of
sense,
repetitive
and you
head
would-
injury.
I think that's already happening to an extent.
Yeah. In terms of safety equipment, we've talked about helmets, and that there is potential for them to reduce head injuries, but there's also concern that they could actually, that the benefit is not entirely proven. So research is happening. And so the coroner urged the AFL to continue to complete this research as soon as possible, but didn't go so far as to provide any formal recommendations about the use of helmets. Some other cooler technology that does exist that the international expert witness discussed and talked about is mouth guards with built-in accelerometers.
Ah.
And so then they are able to monitor head injury through the detection of immediate slowing of a player's head, which sounds kind of cool.
Yeah, that's a great idea.
I don't know how that works if
How
you
would
just
it-
turn around quickly, but I assume that there is a difference
I
in
think there is,
acceleration
yes,
versus
yeah.
like an actual head knock.
Collision.
Yep.
The AFL has commenced some research into the use of these types of mouth guards for head injury monitoring, but again, it wasn't complete, so they haven't mandated it.
And again, it's not preventative. It's
Yeah, it's just for monitoring.
Yeah.
It's just to, but it's to then tell, okay, how severe was that knock?
no, it'd be very useful.
And it would then give you, because you talked about like, is there a number that you have to stop at? It potentially also helps with that numeric count. The coroner recommended the AFL take all reasonable steps to promote and extend the use of mouthguard accelerometer technology in the elite clubs, with the aim of 80% player uptake for the 2024 AFL season. No, none of it was not implemented in 2024, just letting you know. He released this in December 2023.
Yeah,
What
that's
did he
a long
expect?
time.
No.
And this is despite strong urges from the AFL being like, it's ongoing research. It involves a number of different stakeholders. We can't just start it now.
Switch that on.
Yeah, we can't accelerate it any faster. There's a whole bunch of privacy issues. There's like business issues with implementing that. But then also the concept of, cool, then that's recording everyone's data. And so then all of the AFL players have to agree to that if if you try to mandate it, blah, blah, blah.
Yeah.
And so, it seems so much easier said than actually done.
Yeah.
The coroner's suggesting it's just like, do this. And it's like, no,
That's not how that
yeah, that's not how that's going to happen. But I did just quickly Google, and it looks like maybe the Australian NRL might be implementing them or have some of them implemented or available for some of their elite players. Because, anything that I talk about in AFL, let's assume could be essentially enacted in rugby.
Yeah, the coroner didn't specifically talk about that though.
No, that's the thing. He
It's
extended,
really interesting that it's
extended
talking
the scope to the things that Shane took part in.
Yeah, but
not
not
beyond that. Yeah, look.
That's odd.
Other player monitoring could include the incorporation of standardized neurological baseline testing for players, suggested potentially at the beginning of a season and then, periodically beyond there. So I don't know, at the beginning of every season or like midway through, whatever. But that's sort of not done. What does having that baseline testing do? At what point do you call and say, well, you've changed by X number? there's no evidence as to what you could actually do with that data
Yep.
other than use it for research over time.
Yeah.
But it's not actually going to affect anything at this point in
It's
time.
not going to help that player themselves necessarily.
Well, it might if they say that they're having a decline, but how much of a decline is you've gotten
Age.
older
Yeah.
versus this is concerning?
Yeah.
And then, well, again, it's not preventative. You've watched a
the
decline.
damage has already happened.
Yeah.
It's just whether or not you're making it worse.
Yeah. But the coroner did recommend that it should be implemented.
Of course.
Of course. And then another discussion occurred around the voluntary retirement of players. So while there's no formal recommendation, the coroner assessed how the AFL could manage those with deteriorating neurological function. It was noted at the inquest that there is currently no formal criteria or guideline to mandate a player's retirement should a player be identified as suffering symptoms that may be suggestive of CTE.
Again, because they have their own autonomy.
Exactly.
They can make their own choices.
Fair. The AFL's chief medical officer did state that the AFL have set up support panels and the Players Association can help them determine if maybe they should head towards that direction if they've had a lot of head trauma and that they are showing signs of
Voluntary
changing.
redundancy.
Yeah. Yeah, essentially.
Yeah, but
again,
a
like-
redundancy where you don't get paid anything
exactly. What's
for
the
retiring.
Yeah, what's the
There
incentive
is no
there?
ongoing pension for these players.
Yeah.
There's no ongoing payments once they've retired.
Yeah.
Unless I guess they've got endorsements or
Yeah.
Maybe they should put a program in place. Like,
Maybe they
There
should.
needs to be some sort of.
do you get paid super for? I assume you do.
I'm
if
assuming
you're-
you would, but like there needs to be some sort of, if they are forced into retirement, there
Yeah.
needs to be some sort of compensation for
like
that,
a work
right?
program or like
Exactly.
Yeah.
Like, well, you said, do they have access to their super? Well, oh, sorry, do they get super? Well, yes, but they're retiring at 35.
Yeah.
So
Yeah.
you still got another 30 years before you can access your super.
Yeah.
So,
That's not really going to help you in your day to day.
yeah.
Especially if you've probably got young kids by that point.
Yeah, absolutely. Finally, with regards to education, the coroner recommended that AFL consider education to players about brain donation at the end of their life for
Oh, yeah.
future research as well.
That makes sense.
That's fair.
So again, I don't know what percentage of people do, how many people end up with these types of autopsies, again, for that ongoing research of how frequently does it actually happen. But that's going to require a lot of people.
Opting in to that.
Yeah, and I guess when you've got people now, the delay between when they played and when they're having their autopsy typically means that the head injury strategies would have been vastly different.
Yeah, absolutely.
So, even this was, 10 years after he retired, and there were already completely different strategies in place for head injury.
Yeah, you've almost got to try and run this program for people who've played AFL and are now in their 50s, 60s, 70s,
Yeah, the education about donating and stuff like that.
Yeah.
Absolutely. Yeah.
rather than the current cohort. I mean, yes, still for the current cohort
Yeah.
as well, but
Making sure those that are older.
yeah.
It would be great if they could just diagnose this without autopsy.
Yeah.
Because, like, realistically, that gives you the best study
Yeah.
participants, people who you can identify while they're still alive.
Yeah, because then you can try to figure out how to also manage it while they're still
Yeah.
alive.
Yeah.
Yeah. In terms of boxing, obviously risk mitigation for me in boxing would be if it
Don't
didn't
box.
exist
Yes.
as a sport.
You wouldn't need to mitigate the risk because there would be none.
Yes. So many, I was just like, why? Why do people still hit each other? Anyway.
Willingly. Yep.
So the coroner did acknowledge that there are some changes being made in boxing specific to Victoria, because this was a inquest that occurred in Victoria and so could only be directed at boxing within Victoria.
Yep.
But yeah, it could be directed at things outside of how he actually died. It's just, anyway. Professional boxing is regulated pursuant to the Professional Boxing and Combat Sports Act 1985, the Professional Boxing and Combat Sports Regulation 2018, and the Rules for the Conduct of Professional Boxing Contests in Victoria 2018. As I mentioned in the previous episode about boxing, there is no formal relationship between professional boxing and amateur boxing in Victoria, so this only relates to professional boxers which have to be above the age of 18. The purpose of the Boxing Act is to reduce the risk of malpractice, promote safety, and uphold industry integrity by ensuring those that hold licenses are fit and proper persons. The board is responsible for the oversight of professional boxing and combat sports in Victoria and is responsible for supervising the conduct of weigh-ins and promotions. At the time of Shane's death, all professional boxers in Victoria were required to undergo a pre-fight medical examination by the ringside physician within 24 hours of the contest, and subsequent examination immediately following the fight. And so at this post-fight examination, the physician did need to complete a declaration stating whether that individual was medically cleared to fight in the next contest or not. Mm-hmm. And if they weren't, to nominate a non-fight period during that examination. So essentially, if they had a concussion, they could say, cool, this person can't fight again for at least however many days because of their concussion.
Yep.
But that was done like immediately post the fight. So I also like, what happens if you have symptoms onset the next day or something like that?
Or even this was like, we're talking about CTE is a very delayed onset of symptoms. So again, what happens when your boxing career is over and then you have this
onset and stuff like that? But I guess, you know, there was some sort of attempt at risk mitigation of injury, but not specifically with regards to head injury. It was just saying they did have an assessment, and if they were not fit to box, then hopefully the medical examiner would suggest that.
Do you know whether they would then forfeit, like if they had a match booked in for 2 days and the doctor says you can't box for 5 days, do they have to forfeit that next match, or do they just reschedule it?
I have no idea. Ultimately, as of 2018, a mandatory 15-day non-fight period for all contestants has been imposed. So that won't happen anymore.
Yeah, that makes sense. Yep.
Everyone has to book fights at least 15 days apart.
Yeah, great.
15 seems like an odd number in terms of weeks and what days of the week that you have fights, but whatever.
Yep.
I'm sure it's to do with maybe the head injury risks.
Yeah, rather than the days.
The days of the week and stuff. So regardless of outcomes, you can't have another professional fight.
Yep.
So I guess you could have amateur fights.
Yeah.
Yeah, or train for the next 15 days. In addition, as of 2018, medical practitioners have also been given the right or the authority to stop a contest at any time if certain criteria are met. It didn't discuss what criteria, but again, presumably around that safety of head injury, but also other injuries.
Yep.
The medical practitioners can be like, we're done here.
Like, you just broke your leg, you need to stop.
Yeah.
Or there's blood coming out of your ear,
you need to stop. But I also don't know who's employing these medical practitioners and how that relates to their biases and independence and all that kind of stuff as well. And the pressures that they would likely be under. Could you imagine if it was whatever fight that's making much money and how much people would hate you if you said, you know what, he's probably a little too injured in this game that we play to hit each other until they pass out. Anyway.
Yep.
But the coroner did find that these recent changes that have been enacted by the boxing board to be reasonable, but then suggested, as per the expert witnesses' recommendations, some extra formalised recommendations, including that educational material be made, which is explicit to discussing the risk of developing CTE from the practice of boxing, including during fights and sparring. So you can't just be like, I'll fight less or I'll spar less or whatever.
Yeah.
You know, any head injury is a head injury no matter when it occurs. The board explore ways to reduce the amount of sparring during training. And I'm like, does that not defeat the purpose of the training? But whatever. I guess you can use gloves and bags and whatever. But
yeah.
And we have seen, unfortunately, the young guy who ended up with a subdural hemorrhage as a result of his sparring. Yep. So, and then the board investigate the viability of amending boxing rules, such as the length of rounds, the overall length of a fight, and the scoring system to reduce the amount of head trauma experienced by boxers in their career. So just change everything.
Oh, yeah, sure. Cool.
Just better yet, don't box.
I mean,
was essentially what I got from the coroner's recommendation, was just like, stop this game.
Yeah, look, that
sport.
seems reasonable. Hey.
It does. The board did implement some education material that all professional boxers are required to show understanding of before they're able to be registered or renew their registration within Victoria now. So I assume you have to do some sort of online mandatory certificate.
You got to tick some boxes.
And unless you've ticked those boxes, you cannot be registered.
Yep.
That's fair. Coroner also was like, yep, implement those mouth guards as well. Make sure that they're available so that if people get hit in the head, you can measure the acceleration.
Were they talking about boxing in that situation with the mouth guards?
Oh, yeah. That's what I mean. Like, as in, not only did he recommend it for the AFL section, he's also like, yeah, chuck it in for boxing as well.
AFL, but boxing, you know.
When they've been hit in the head.
And the force of being hit in the head.
Again, I guess it's maybe around how high was the speed change.
Yeah.
I don't know.
Yeah,
It's
I feel like it's more relevant in AFL.
Yeah, but also, like, why not?
True. I mean, they're wearing mouth guards either way.
Yeah.
So,
True,
like, why not just change the one? do baseline neurological testing so that can be monitored over time, along with for inclusion in research.
I feel like for all boxing, it is going to decline.
Depends how many times you get hit in the head, I guess.
Yeah.
If you're good and don't get hit in the head.
Well,
but
true. If you hit the other person in the head well enough, you'll be
hit in the
fine.
head. Depends what fights you're setting up. If you know that
Yeah.
there's a high chance you are going to win, then
Yep.
maybe you won't get that many head injuries.
True.
The coroner recommended that a current review that was being undertaken by the Department of Jobs, Skills, Industry and Regions be extended to include amateur boxing in Victoria rather than just professional boxing. I don't know how one does that with legislation that says that it's not regulated that way, but the coroner did say do it. And make sure that head injury is included within that review. And then the coroner also went on to recommend that a national boxing register be implemented to assist with all of these policies that are being made and recommended, so that also when boxers compete nationally, things like this 15-day rule are going to be acknowledged by the interstate.
Oh, yeah.
And also to make it easier for people to access things like the boxers' serology results, their medical results, fight history and all that kind of stuff. Because at the moment it's very segregated within the states. And so there was evidence that Shane had been training in South Australia and fighting in Victoria or vice versa. And so it was concerned that maybe there were other fights that weren't necessarily declared relevant in this because they couldn't identify them.
And like that part of it makes sense, that you would have some
Crossover of borders?
interaction between the different states.
Yeah, and especially when you're getting to a really elite level, I imagine that fights are organised between states. But then when you're at that elite level, I think the number of boxers in Australia is very limited in comparison to the number of AFL players. So
True.
like,
Oh, yeah.
you probably know how many fights that person's been in because, you know, it's public knowledge or whatever. Finally, the coroner recommended to the board and the departmental review process that the current rules and regulations for professional and amateur boxing in Victoria restrict persons under the age of 14 years from participating in any boxing activity involving hits to the head.
Yes. Isn't that's not already a thing?
Doesn't seem like it's specifically mandated.
Oh.
I mean, I presume it's generally not recommended.
No.
But again, there is no evidence that Shane ever boxed under the age of 18.
Yeah, true.
And so I'm
Because
like,
he did it after he retired from AFL.
Yeah. And that it was never a huge crew for him.
Yeah.
So the coroner even went on to state, I acknowledge that there is no evidence that Shane participated in boxing as a child and that participants in professional boxing matches must be over the age of 18. However, I do not consider myself to be restricted to making recommendations which are directly connected with the circumstances of Shane's death.
You would be the first one.
So I am
The
just
rest of them feel
taking
restricted.
a liberal approach, this coroner.
absolutely, because I'm like, well, if you don't consider it relevant, why don't you just like any bugbear that you have ever had in your life just include in this inquest?
Just any report. You just need to write a list of your bugbears.
Just chuck it down. I'm like, you know, well, if you extended this to Shane never doing boxing under the age of 18, why didn't you implement the rugby helmets and the accelerometers and the changes in rugby league instead
or no
of
AFL under the age of 15.
Yeah, or no contact under the age of 15, or the moment you have a head hit, that's it. You're never allowed to play again.
Yeah.
I mean, to be fair, these after all are recommendations, so he can really just say whatever he wants. It doesn't mean
True.
they're going to get implemented. But like,
True.
I feel like there should be
They should be
the
reasonable.
scope should be a little bit tighter than maybe what.
Yes.
And I get it. Like, it's all about trying to protect public safety. So I get why the coroner's doing
It's not
it.
coming from a bad place. But
No,
like,
not at all.
It's maybe just a little too
Stay
far.
in your lane, maybe.
We've seen both extremes.
Yeah.
And this one for me was so far on that other side that I was like, what's next? What else are you going to recommend? Like, oh, where is this going? How far away from anything related to Shane Tuck are you going to get?
Yeah, yep.
But it only got to the age of 14, so we didn't recommend changing things about Shane's early years.
Okay.
Good.
And that was the last of the recommendations. But that statement around making recommendations not directly connected to the circumstances of Shane's death was a few times in there. And the more I read it, the more I just was like, oh, okay, apparently you can do that now.
Yeah, they've clearly acknowledged that this is not what normally happened. They're still going to do it.
Well, yeah, because you could just see the people providing. So the interested parties were obviously the AFL, the Victorian Boxing League, even the Richmond Football Club and stuff were providing their feedback within this. And you could just see every time the coroner was like, you should do this. And each of those people just going, but that has nothing to do with Shane Tuck's death. And he's like, yeah, I'm going to say it anyway. Yeah. So that was interesting. And then, yeah, as I said, I struggled with I think the international expert was the right person to get to review all of this, but I think some of those recommendations were a bit too restrictive and not enough related to AFL.
Yeah.
But it may just be their knowledge of AFL might be limited. And so I struggled a bit with those recommendations, being like, I'm not sure it's as applicable to Australia. Also, they were the medical director of the clinical research centre named after them. So it made me a little more suspicious of their recommendations. They were all logical, but just not necessarily directly related. So that is the inquest into Shane Tuck's death. And I think all of the discussions kind of been had throughout. So thank you very much for listening.
Thanks, everyone.
Thank you.
Bye.
Bye.